So I think we'll go ahead and get started. Hello and welcome to this session of the SLN Conference, The Promise of Employment First. My name is Rebecca and I'll be the moderator for this session. If your camera is on, we can see you, and your microphone is on, we can hear you, so please remain on mute. Use the chat box or raise hand feature for any questions that you may have. As a reminder, this session is being recorded and will be made available to SLN members in our online archives. I'll place a link in the chat box for the handouts. And if you need CEUs for today, please type your name in the chat box as it appears on your registration form, just so we can match it. And then we'll also ask at the end of the session to put your name in to verify attendance. Again, that's for the CEUs. Excuse me, Bob, if you want to go ahead and get started for us.
Sure. So, can people see the beginning slide, the promise of employment first?
Yes, we can see it.
Okay, good. So before I get started, Rebecca, are people able to, are you going to be monitoring the chat for questions?
Yes.
I am more than comfortable in answering questions as we go along, unless it's your preference that we answer questions at the end.
Okay.
And we go till the top of the hour, till 12 noon?
Correct. Yeah.
Okay, good. All right, well, welcome everyone. It is certainly my pleasure and honor to be presenting to you all today about employment issues, and in particular, employment first, and what that means to your sibling who experiences disability. A little bit about myself. I've been in the field of employment provision for people with disabilities, and particularly people with more significant disabilities, golly, since 1976. So I am an old timer when it comes to this issue, and have had a lot of experience in the various models of employment that we've seen in the past, and that are being talked about as the future. And just to clarify, the future is basically just regular old employment. It's not any of these models that we've developed through the years. It's not sheltered work. It's not mobile work crews. It's not anything other than real work for real pay with a regular employer, with ongoing supports for those individuals who need them. And so that is what best practice services are all about at this point, and that is certainly what Employment First is all about. So let's dive into Employment First and what that is referencing. So basically, these bullets on the next two slides describe where we're at as far as Employment First and what it means. So the primary reference here is that when we look at public dollars that are being used to support people with disabilities, work needs to be a priority. And as opposed to it being an afterthought, that we need to see our state and local and federal dollars going directly to assist people in their efforts to become employed. It's just a plain old fact that too many people with disabilities don't have a job. And these bullets, let me explain, these bullets actually come from self-advocates becoming empowered. If I were there standing in front of you today, I'd be asking how many of you have heard of self-advocates becoming empowered, but basically, Self-Advocates Becoming Empowered, or SABE of the USA, is the national self-advocacy group for people with significant disabilities. And they have put together the next few bullets here as an adaptation of the APSE principles about this. And these acronyms are explained on down the line. But basically, APSE is the Association of People Supporting Employment First. It used to be the Association of Persons in Supported Employment, but about a decade ago, as Employment First started to become more widespread throughout the nation, they changed their name. So this is an adaptation of APSE's information on this issue. All people should have the opportunities for real jobs with real wages. And this includes people with the most significant disabilities. This includes people who, in the past and even today, are considered people who would not be able to work because of the impact of their disability. And we're at a point right now where such a person doesn't exist. We can always figure out a way for someone to participate in regular community employment or self-employment within regular community settings. This is referred to as a zero reject model, where basically everyone is welcomed into the world of work. It is basically the responsibility of service provision, of service providers, to determine what the best ways are to support that person or to provide options on support, and then have that person choose what options they want to go ahead and use. So earning minimum wage or higher is also something that, with the proper supports, we believe is open to anyone. However, of course, all of us need some level of support in our jobs. Although we like to think of ourselves sometimes as rugged individualists, all of us access the supports of our coworkers, of our team, of our manager, of employee assistance programs within the workplace. And the same is true for people with disabilities. We all need supports in some way. And the right to have a job that is consistent with your interests and skills, of course, is something else that's open to all of us. Public policies have to support these recommendations to go ahead and make sure that people have access to real jobs. And then, as I mentioned before, this is SABE's, Self-Advocates Becoming Empowered's adaptation of APSE's Employment First Statement that was put together a couple of years ago. So those two slides gave you the less technical aspects. I think this public policy, particularly federal public policy language, sometimes is very confusing. But this is what you'll hear at the federal level. And as you hear people talk about employment first, these pieces here, these two bullets are what you'll basically see at that level. So you can see we're talking about systems change here. And the reason that systems change is the focus on the federal level is because we know that the current systems in the states are not working to provide people with real community employment within their local communities. The system is broken, and so the emphasis here is on changing those systems to include all people with disabilities. And basically, as was stated in the previous slides, publicly financed systems need to commit to integrated employment as the priority option for the use of those federal dollars. So let me go back a moment to the title slide. You may have noticed that I pushed another piece of that title in there when I was referring to what this presentation is all about. You'll see, and a call to action. The reason I've added this is because I'm getting ready to retire. And I need people like yourselves to basically collaborate and connect with the entities within your individual states to make this happen, because we've got this dream, we've got this vision. This employment first thing is increasingly being implemented through legislation, through executive order, through rules and regulations within the states. But systems change is hard and it lags behind. So we need to have you get a little more involved in these kinds of activities. And part of what we're doing today is to not only tell you about best practice and what that involves. In other words, we know the solution now. We know how to get everybody employed. It's just a matter of getting that best practice implemented at the state level. And there are civil rights laws that basically demand that we make this systems change. But systems don't like to change. And so we need advocacy. And particularly with the strength through connection uh, theme of this conference, that fits so nicely with this, because we've got to collaborate with our local entities at the state level. And we'll talk a little more about that in some of the other slides, to basically come together and through that connection with each other, advocate for this change so that our sons, daughters, brothers, sisters, people we care about can access employment in real community settings. So back to this promise for everyone, best practice that we've actually had, believe it or not, we've actually had knowledge of these best practice uh, components that we're using right now for about 20 years. It was really around the turn of the last century that we started to realize some of these ways of making sure that people can really get into employment no matter how significant their disability. We've got discovery assessment. And again, if I was in front of you, I'd ask how many people had heard about that in the past. But basically, discovery assessment is speaking to trying to determine what a person's real interests are and what really turns them on, and uh, basically getting to know a person's home life, their social life, um, things that were not traditionally considered an employment-like assessment, to get to know the person, to get to know what the person enjoys, to get to know the people that that person enjoys, and to even, uh, in many cases, ask individuals who know the target person best, what are this person's interests? What do they like to do? What are things that we need to avoid in an employment setting because it may be a trigger for behavior or discomfort? Uh, so that's what discovery is all about. Customized job development, again, has been around for about 20 years now. And that's a thing to make sure that we look at both the interests of the employer as well as the interests of the job seeker. And we make negotiations around schedules, duties, and job conditions that meet the need of both parties. This, I'm going to jump ahead one here. This young man that you see here is my son, and his name is Jess. If you can't figure it out from the first photograph there, you certainly can from the second and the third. He works at a pizza place. But my son was told throughout his school career, and as he switched over to adult services, he's 25 years old now. But as he was looking at transitioning from school to work, and was certainly prior to that in the school system, we were told, well, you know, Jess might be able to do some volunteer work when he gets out of school. And, but, you know, community employment in a regular employment setting is something that's going to be out of his reach. Well, Jess didn't see it that way. He, you know, he's like many people, I guess, he has a love for pizza. I better just say it. And he basically had decided when he was very young that he wanted to work in a pizza parlor. And so he works at Cosmos Pizza. He doesn't work for very many hours a week, but his gig is folding those pizza boxes that you see in the second and third photograph there. And the first photograph is him after he's done his shift. He gets a free slice, so he likes that part of it too. But Jess is you know, he's untestable. He just can't be tested on an IQ test. His, you know, I can't tell you what his IQ level is because he can't be tested. He's very difficult to understand verbally. You might understand 10% of what he says if you don't know Jess. I probably understand 60 to 70%, but Jess has some real significant issues when it comes to learning and when it comes to communicating and quite frankly, when it comes to working. But this young man is holding down a job because of customized job development, where we basically found out that most pizza workers in this pizza parlor, Cosmos Pizza, it's called, They make boxes, they make pizzas, they deliver pizzas, they run the cash register, they wipe the tables, they fill the soda refrigerator, et cetera, et cetera, et cetera. Well, Jess can't do all those things. And so we did what's sometimes referred to as job carving. We carved out some of those duties that everybody else does that he's able to do. And that includes making pizza boxes, which is his primary job duty, but also wiping down tables, filling the pop cooler for sodas that people buy. Those are things that he can do and things that he can excel at. And quite frankly, some of his coworkers don't like doing those jobs so much anyway. So he fits in real well. That's Tertia in the third photograph there, his boss, who is presenting him with his first paycheck last year. And I'll tell you, he really enjoys his job and certainly really enjoys the paycheck. And of course, really enjoys pizza. So back up, customized job development is what I just described. That customization of a job is how Jess was able to work in that Cosmos Pizza location. He can't run the cash register, but he can sure do some critically important tasks that the employer needs done. And so we meet Jess's need to be employed and the employer's need to get certain tasks done. Systematic instruction, the next bullet there, is another technique that's used for people who find it difficult to learn. And that just is a matter of good teaching, reducing verbal cues for people who don't respond well to them, using more of a visual teaching technique, which is what my son responds to and many people with more significant disabilities respond to. And so that's just another tool in the toolbox. Self-employment, I mentioned before. The example I like to use there is the guy who several years ago was able to get a job at Motorola in Texas. I don't recall what city it was, but he's a guy who is completely paralyzed and is able to self-ambulate through by using basically a wheelchair that allows him to use his fingers, because he is able to use one hand, to a joystick, to be able to use that joystick to move around. But besides being able to use that one hand to use his joystick, the only volitional movement that he has is his smile. And so you say, well, what can he do? Well, what he did was he basically purchased a coffee making machine and works through a number of those shifts at Motorola, the morning shift, the noon lunchtime shifts, and the afternoon break shifts. And he makes a great living by simply basically tending his machine, and people make their own change. And he has an attendant for some of his personal needs, but is basically able to make a living through self-employment within another business, which is an option that people don't often think of, perhaps, but one that's very viable under certain circumstances. So self-employment is another one of those areas where people who may have significant barriers to employment because of their disability can move forward and actually become employed in a regular community setting. And then technological support is rapidly progressing at this time, and those kinds of programs that help people get cued at the right time to do a certain part of their task. For instance, my son, although he's not using this yet, but we think he may be, if my son just simply makes box after box after box during his shift, he needs to be reminded to talk to his manager to see if he's done enough of those, and he needs to switch to the next job. So after 15 minutes, this kind of prompting piece on his iPhone would simply, after 15 minutes of starting work of his shift, to say, okay, check in with your manager to see if you need to switch to a different kind of task. So that technological support is not well developed right now, but we believe will be providing more opportunities for people to be more independent within the workplace. So we've talked about Jess. So now we're going to get into some of this public policy stuff, some of the civil rights stuff that I want to make sure that you understand, because we are on the right side of this issue legally and morally as far as that goes. So what's happened now here, I've put another term out there, supported employment. So I haven't really defined this. Supported employment is three things. It's paid work in integrated settings with ongoing support. So those three things: paid work, integrated settings, ongoing support. So the customization that we talked about earlier for my son Jess, it is a part of supported employment. My son will need ongoing supports for the rest of his life. Basically, he has a job coach who checks in sometimes weekly, sometimes every 2 weeks, but no less than every month, to make sure things are going okay in his job. And many people with more significant barriers to employment that result from their disability need that kind of ongoing support to make sure that intervention is not needed in some way. So this whole idea of supported employment has been around since the mid-'80s. So we've had well more than 30 years of implementation at this point. And still, at this point, it's estimated that only 20% of individuals who receive state-supported day services are working in integrated employment settings. And 2017 is the most recent national statistics that we have for this. We actually, 20 years prior to this, in 2001, we reached a peak of about 25% of all people being in integrated employment settings, being served in integrated employment settings throughout the different states. But we have been stuck. We went down from that 25% point from 2000 to 2005, and we've been stuck at right around 19-20% for the last 20 years. And there are significant differences across states. And the next slide shows you a little bit of those differences here. So these are the top performing and the less than top performing states, and how they perform in this area of looking at the percentage of people being served in the state service system and what the percentage of those individuals are who have jobs in the community. And you can see Washington State. Washington has been at the top of the list for many years now. Washington State is at 86% of those individuals served by the state for day services are working in competitive integrated employment at this point. And what's happening in Oklahoma and Oregon, those are the top three states. So you see there's quite a difference between Washington and second place and third place. But what happens at the other end of the scale? You see some states at 6%, 5%, 2%. And as I mentioned before, the national average is right at about 20. So again, if I were standing in front of you right now, I'd be asking, does anybody have any ideas about why we have a variance of 2 to 86% in the various states? Moderator Rebecca, can I ask people to if anybody has any ideas to throw something in the chat?
Yeah, they can put it in the chat box.
Does anybody have any ideas on this? Why in the heck would we have 86% of people being served in state systems in community employment in Washington State, but only 2% in Hawaii? Anyone? And Rebecca, are you able to see the chat box?
Yes, I can.
Good.
So Dawn asked, are the states with higher percentages ones where customized employment have been implemented?
Very insightful. Good. That's good. You're connecting the dots. Yeah, it really gets down to state policy. And you're right. Washington State has a vibrant service provider training entity. It's called WISE, the Washington Initiative on Supported Employment. And WISE has been training people for several decades now on best practice like customized employment. And so you've got a well-trained provider network, service provider network. You also have a state system that is committed to community employment for people. In fact, Washington State, for many years, well, they still have a conference that is nationally recognized and many people from around the nation come to. I've presented at it a number of times, but it was called the Ellensburg Conference, and they've had that going, I want to say, since the late 80s. So they have many years of changing the culture of services within Washington State, both within the state administration, where services are monitored and rules and regs are made to guide those services, and within that service providing system, the people who actually work with individuals with disabilities. So yes, it's really a matter of state policy. There's been strong state policy in Washington State to make this happen, and that has been a major reason why they perform so well in this area, while other states lag behind. My own state, Colorado, is only at 19% at this point, and we were actually over 50% in the 90s, and as we approached the turn of the century, we started to decline, and then went down to 10% about 5 years ago, and now we're trying to build our way back up through legislation and changing state policy and practice to support people in employment. So yes, good answer. So these pieces right here are really the titles of some of the next few slides that I'm trying to give you so that you understand that we, as advocates for our siblings or sons or daughters, are completely justified in demanding this, in basically demanding that our brother, sister, son, daughter has an opportunity to be in community when they are working. And so we'll go through each of these in turn. The other thing is to keep in mind that we have the 14th Amendment. I'm not going to spend a lot of time on this, but the Equal Protection Clause within the Constitution, which is the basis of the Supreme Court's Brown versus the Board of Education of Topeka, is the basis for our civil rights as a group, as people with disabilities. It's basically saying that separate but equal is not equal. It simply isn't. And people who try, you know, with all the best of intentions through the years, we've tried to figure out ways to make sure that separate programs for people, or these separate settings that are segregated and separate from society, makes sense for people. Segregated schools, segregated workplaces. Not only does it not work, but it's against the law. And so keep that in mind as we talk about some of these things. This whole piece about Olmstead is what you'll hear most advocates refer to who understand these legal demands for justice for people with disabilities when it comes to integrated work and integrated housing and being a part of the community. The Olmstead ruling was an interpretation of Title II of the ADA, the Americans with Disabilities Act, and basically said that everybody utilizing public services through state and local government have a right to be served in the most integrated setting possible. The vast majority of states, there are a number of states who have been sued that we'll get into in a moment, and who, because of their suit, are basically following the law, because the federal government has said you must change and move to integration within the next few years. But besides Rhode Island and Oregon, all the other states are out of compliance in this area. I mean, even Washington State, and you can argue Washington State is doing so well, nobody's going to buck them because they continue to improve. But if you're not serving everyone in integrated settings, you are not compliant with the Supreme Court's Olmstead ruling, which basically demands that you serve people in the most integrated setting. And as you can see at the bottom in big letters, this is a civil rights issue. I include this gentleman because he and I did presentations for many, many years. This Clarence Miller was a self-advocate here in Colorado. He's no longer with us, but he experienced working in 3 different sheltered workshops and would present alongside me in various national venues because he had direct experience with, um, well, it'll make me cry if I talk about it, all the experiences he had. But basically, Clarence would get up in front of audiences and relay what he had learned in those segregated settings about how he was treated, about how it was a barrier for him making friends with neurotypical people. And so you can see this quote here. I'm sick and tired of professionals trying to put me in sheltered workshops. Olmstead says people with disabilities have a right to work in the community. This is ridiculous. So I miss Clarence. He was a great co-presenter with me, and I always try to include a picture of him. Now here's Chester Finn. I mentioned SABE before, Self-Advocates Becoming Empowered of the US. Chester was president for SABE for a number of years. Golly, it's been a while. I think he may have left that position in 2012. But this is a great quote from Chester where it relates to employment. Other groups fighting for their civil rights would not stand for separate places. Neither should we. So this was within a policy statement that he made in 2010 for self-advocates becoming empowered of the United States. Chester is still around and still advocating strongly. So this is the SABE policy. You know, I'm realizing I didn't spell out SABE. I believe I did in the references at the end, but again, self-advocates becoming empowered. This is the policy they put out in 2009, so 12 years ago. This was really this was when Employment First was just starting to gear up and figure out what they were all about. And here are the self-advocates basically leading the way, where they're basically saying no more new people go into these segregated sheltered workshops, no more people going into enclaves. Enclaves are a reference to these groups of people of 4 or 5 or 6 or 8 people doing work in community settings, but still being congregated together because they have a disability. SABE, as you can see, felt in 2009 and continues to feel that these kinds of groupings, congregation of people just because they have a disability in the workplace just doesn't make any sense. I actually have personal experience from the 80s, the early 80s, where I ran an enclave at IBM Boulder. And I did the best job I could to connect people with IBM, regular IBM employees. But I'll tell you, people see you running around in a group. It's very difficult to reduce the stigma that's already there because of disability when you see people grouped together as if that's a necessary precursor to them going ahead and having a job in a community setting. So they're clear on the enclave piece too. Of course, ending subminimum wage, they wanted that done by 2012. The transformation to competitive integrated employment act has been reintroduced in the current Congress. We're hoping to see it pass this year, but we shall see. Basically eliminating this sub-minimum wage employment that occurs throughout the country. I'm trying to think of how many states have outlawed it. I believe there's 6 states that have outlawed it. Colorado just joined. We just passed that 3 weeks ago here in Colorado, where we got rid of sub-minimum wage employment. And then you can see ending all enclaves. NDRN, the National Disability Rights Network, is an organization. It's the National Association of Protection and Advocacy organizations throughout the US. This was, and again, I'm not as sappy as I sound, but I actually cried when this was published, and I spoke to one of the people at the national office about this. Segregated and Exploited, if you haven't seen that, and there's in the references, you'll see the actual link to this. This was just a scathing report about what actually happens in many sheltered workshops and other segregated enclave-like settings. So I'm not going to read through this, but you have access to this slide in the next one. Kurt Decker, their director, just basically laid out the truth about these settings that have been perceived to be these wonderful places where people can get employment experience, what we found is that they don't train people in job tasks that are really useful, that in fact, the training you get in a sheltered workshop trains you to work in a sheltered workshop and not much more. So anyway, this is another thing, another piece that was done nationally that really clarified that segregated employment does not make sense for anyone. Now, Oregon and Rhode Island are two states, as I mentioned earlier, that have settlement agreements with the Department of Justice to correct this segregation problem. And so this was actually the first class action suit that self-advocates, Paula Lane and 7 other self-advocates from Oregon, basically with the assistance of the local protection and advocacy organization, Disability Rights Oregon, sued the state and were able to get class action status to do this, and they won. So they sued Governor Kitzhaber and then Governor Brown after Kitzhaber left to give them real jobs with real pay. And so the 2015 settlement agreement basically between the Department of Justice, the US Department of Justice, and Oregon assures that over 6,000 Oregonians with intellectual and developmental disabilities will be able to get employment. And this you'll see the last bullet is bolded because this is where the rubber meets the road. What happened in Oregon after this settlement agreement was that they went from 33% to 57% of all individuals being served by the state with intellectual and developmental disabilities in integrated employment. So if we have to, we can sue the state and get the job done. Now, most people don't have the time or the resources to do that, but this is an example where self-advocates came together, strength through connection, came together and sued the state, and Oregon, it's on its way to eliminating that kind of segregated employment. The National Council on Disability, I'm not going to read through this either, but you can see that basically they addressed segregation, they addressed the minimum wage and sheltered workshops. They also found a fact based on research that it helps taxpayers to actually move toward integrated services as opposed to segregated services. This is true in housing. It's definitely true in employment, where we found that you can reduce the cost of the service because in these integrated employment settings, a natural part of that is what's referred to as fading your assistance. So you're a job coach, you're helping my son Jess get a job, you're gradually fading your assistance so you don't have to be there anymore. Instead of being there full time every day, the service provider, the job coach, checks in once a week, once every 2 weeks, once a month, to make sure that that job is still going okay, and then coming in periodically to provide intervention, but it's not every day. And that results in a significant reduction in the cost of the service. So this is basically another piece that, again, focuses on Rob Samara's work in 2014 that showed that, and Rob has done studies through the years, over 20 years of doing studies on this cost benefit of integrated employment versus segregated employment. And so we found that it costs less. And anyway, there's some other bullets there that you can read at your leisure. So then we got a settlement agreement in Rhode Island as well. And they preceded, in their settlement agreement, preceded Oregon by a year. But basically, we saw the same thing. We saw that in Rhode Island, in Providence school system, they were basically preparing people in school to move into the sheltered workshop setting, just completely against the law related to the civil right to being served in an integrated setting with everyone else. And so DOJ, Department of Justice, did the same thing, did a settlement agreement with them, and we can see the same kind of even more movement. If you look at the bottom bullet there, from 19% to 40% in the period 2013 to 2017 is the kind of increase in the number of people being served in integrated employment settings, a jump of 21% over that 4-year period. I love this quote from Eve Hill. Eve Hill is no longer with the DOJ, but was a major player in investigating Rhode Island and basically understanding the nature of this discrimination. And you'll see here, unfortunately, the exploitation and tyranny of low expectations we found are an all too common result of the segregation of people with disabilities. That is why we at the Department of Justice will continue to work hard to fight this kind of discrimination. So the DOJ, the feds, have played a major role in this. Related to that is the 2014 passage of the final settings rule. You'll see in the second bullet here that the compliance date for the final settings rule, which again, basically has two major thrusts. One is that people have the right to self-determination. They should be able to choose what they do in home and community-based service settings, that's what funds all of these employment services and most of the residential services. People should have a choice between what options they want to choose, and those options have to include being included in integrated settings within the community. And so this final settings rule is another thing that I ask advocates to get more information on. And just an FYI, my email is on the very title page of this presentation. Please don't hesitate to contact me if you need more information on any of this. If you decide to go ahead and become an advocate in your state for these issues, please don't hesitate to get in touch. But this date for implementation has been extended to March 23rd, 2023. So the states are still working on this. This is an area where you can look at your existing state plan and provide input if you feel they're not doing enough in the employment arena, because this final settings rule applies to all of those settings that are provided through Medicaid home and community-based services. The Workforce Investment and Opportunity Act of 2014 defined competitive integrated employment and made it the standard outcome for our voc rehab system. Basically, competitive, and I'm sorry this is so technical in some places, competitive integrated employment basically is a definition for what I started with at the beginning. It just means regular jobs for people. This integrated setting requirement basically says that you cannot have a particular setting be consistent with the definition of competitive integrated employment unless it's integrated. And the integration requirement basically says it's a job like anyone else has. It's not an enclave, it's not a sheltered workshop, it's not a business that is developed by a local service provider. It is a regular community setting for regular people that would include people with disabilities. And as you can see, we got customized employment into the WIOA, into the Workforce Investment and Opportunity Act, the federal act describing how voc rehab, vocational rehabilitation would work. And so that was another great addition to that federal law. There was also a committee that was established through the legislation that advised the federal government on how to support the systems change throughout the states. And so these are a variety of the ways that they recommended. When you see SE and CE, that's supported employment and customized employment, basically describing those as evidence-based practices, best practice, and that those are what people need to be using throughout the country. It talked about funding. It talked about systems change funds being available so that local states and those agencies that have invested previously in segregation can learn how to get into providing those integrated services and supports that are so important for systems change. Unfortunately, little federal action has been taken over the past 6 years in implementing these recommendations. And we believe, a lot of these references are to DOJ work, Department of Justice work, and some of these national organizations coming out with these statements about the need to go to regular integrated employment services for people. There was the most recent administration prior to this one didn't have that vibrant a commitment to this concept. And so over the last 4 or 5 years, we've not seen the level of enforcement within the DOJ as we did previously. But at least according to the declarations of the current administration, the DOJ is going to start to enforce Olmstead and enforce the requirement that states have to serve people in integrated settings in a more lively fashion, to basically go ahead and move forward and to assist the states in moving in this direction. So there was a modification last year in the Department of Justice Olmstead statement related to people accessing employment services in the states. And so they did define that there needs to be a reallocation of funding away from segregation and toward integrated settings, because again, as I mentioned earlier, it's cost effective. It's cost beneficial for the states to do that. It's a better use of their dollar to use integrated settings for these services as opposed to segregated settings. They also stated that people unnecessarily segregated in these settings include people spending their days in sheltered workshops or segregated day programs. So this may sound like detail that doesn't matter a whole lot, but these are the kinds of things as advocates we can point to and basically say, look at this reference, Mr. State Legislator or Ms. Governor. This is what's being looked at legally from the US Department of Justice. They clearly define these segregated settings as unnecessary, and we need to change that. They also basically said that remedies for Olmstead violations included enhanced provision of supported employment services. So again, remember, supported employment is paid work, integrated settings, ongoing support. And so this idea of supporting people in regular community settings through supported employment and customized employment is central to these arguments. So I like to talk about 3 bottom lines for the states. And so these are the kinds of things as we try to change these systems so that the people we care about have access to community employment. We really try to look at 3 basic things. One is whether the state has an employment first policy. And I can tell you right now that we have many states with employment first policies, but which have no teeth. And by that, I mean, employment first is what the state of so-and-so believes is important for people with disabilities. And there's other language attached, but it doesn't say how they're going to do it. It doesn't state that they will actually be shifting their state system from segregation to integration. And so you need to have the employment first policy, but also a commitment by leadership to do state employment resource rebalancing. And by that, the term basically means is you have to start to get out of segregated services and add dollars to integrated services in order to do that. Money talks, bullshit walks, excuse the vernacular, but you've got to have funding behind this. And without that, to rebalance state resources, these kinds of things are just window dressing when the states say they have an employment first policy. Number 2 here is adequate technical assistance and training. And of course, this is in the areas of evidence-based practices. like supported employment, like customized employment, these best practices that give service providers the tools that they do not have presently to really make this a reality. Many service providers around the country continue to believe that if you have any kind of significant disability, you are unemployable. That is just tragic because we know it's not true. That's what we heard about our son for many years, and we know it's not true, and he's proving that it's not true right now. So people with the most significant disabilities, that's what MSD stands for. Again, I'm sorry for being so technical, but most significant disabilities is the term that's used in voc rehab legislation and rule and reg about people who tend to be in three categories of disability. They tend to have either a developmental disabilities or a mental health issue or a brain injury. And so that population of those three categories of disability tend to be the most discriminated against when service agencies and government considers whether somebody, whether efforts should be made for somebody to be employed. And so because of that presumption of unemployability that happens so often, these people with most significant disability are oftentimes the focus of employment first efforts. Excuse me. And then effective rate structures, where we're making sure that those service providers are getting paid enough to provide these services. That does require that they train their staff in best practices. Increasingly, we're looking at incentives for performance, which is legal throughout the Medicaid system. And so there are ways that we are working on trying to enhance the opportunities for states to really make systems change in this direction work. And those are some of those areas. So what can you do? Basically, this gets to that whole strength through connection. You need to support self-advocates and families to obtain this information on customized employment. People just don't have the information. In Colorado, part of our effort right now is to make sure that we are educating largely families, but also, of course, people with disabilities, that no matter how significant their disability, they can work in regular community settings. School systems don't have their finger on the pulse of this information, nor do adult services in most states. So this is critically important for families and for self-advocates to become informed, because that's where this change happens. It happens through the grassroots. It happens through you and I. It doesn't happen typically by the bureaucrats in state government. We have to educate the bureaucrats. And first, of course, we have to become educated ourselves in order to make this change happen. Here in Colorado, we've done 3 bills over the last 5 years that all push the system in the right direction, but have included this information that we've just gone through to justify the fact that Colorado needs to move in this direction. And this, you'll see the second bullet, basically getting this information to public policymakers so that they can consider employment first legislation. And again, if you're interested in the kinds of things that Colorado has done in this area, please don't hesitate to email me. I can talk to you about some of those things. We basically, over the last 5 years, have demanded that the state do a better job of tracking who's getting employed in regular community settings. We're demanding that service providers have best practice training and technical assistance provided to them. We basically have established an Office of Employment First within Colorado that is responsible for a lot of that training and data collection to make sure that we know that we are moving in the right direction. Without data, you just don't know. And without some investment in training our service providers in best practice, it simply can't be done. And then again, strength through connection, build partnerships with other advocacy groups like Self-Advocates Becoming Empowered or People First. Look at TASH if you have a TASH chapter in your state. APSI, again, the Association of Persons Supporting Employment First. ADAPT, which again, if I was in front of you, I'd say, how many people, raise your hand if you've heard of ADAPT? Well, ADAPT is a group that began in Denver back in 1978 and basically closed down the bus system because it was inaccessible. And ADAPT since then has pushed very hard for integrated residential opportunities for people with disabilities, basically saying that relegating people to nursing homes is illegal. And again, they depend on Olmstead a great deal to try to move local and state government in the right direction. Your P&A, which is Protection and Advocacy Organization, this is the legal arm of the Developmental Disabilities Act that provides each state and territory with an agency that can assure that the state laws are consistent with, when it comes to discrimination, consistent with federal and state rules and regulations and statutes. So the protection and advocacy units are very important. And of course, the state's Developmental Disabilities Council. I work as policy advisor for Colorado's Developmental Disabilities Council. And these, again, are in every single state and territory to try to focus on systems change. And then you can consider an Olmstead complaint. We did an Olmstead complaint here in Colorado back in 2002, and I can't say I was satisfied with the result, but it is a way to get states to move in the right direction. Oregon did it, Rhode Island did it, and those states got the settlement agreement that we talked about in earlier slides to move the entire state forward in a regular, annually evaluated way with outcome measures where they basically have to improve their statistics every year over a 10-year period in order to move their system in the right direction. So that's another opportunity. And then you need to keep an eye on what's happening in your local communities where there may be articles about a sheltered workshop or about people with disabilities working, and letters to the editor or offering to author your own editorial that would go on the editorial page about these issues is also important. It's all about education. Now, Rebecca, can we have people unmute for a minute, for a second?
Yeah, so I was just about to interrupt saying, you know, we have 1 minute left, so we will need to kind of wrap up here.
We are wrapped. If we can get everybody to unmute. I want to see Ann unmute and Luz unmute and Jessica. So we don't end it unless I hear a reply from you. What do we want?
Real jobs.
When do we want it?
Now.
What do we want?
Real jobs.
When do we want it? When do we want it?
Now.
All right. Very good. Thank you all for listening. Don't hesitate to contact me related to any questions that you may have on this. You'll see there are a multitude of links in the reference page here to give you more information, and I appreciate your attention today.
Great, thank you so much. You shared a lot of information and a lot of resources, which is great for people to start advocating in their state. So thank you, Bob. Everyone in the attendees, again, if you can just put your name in the chat box, and you are getting some gratitude, Bob, so definitely take a look at the chat box yourself.
You're welcome, Dawn.
So thank you for joining us for the pre-conference. We hope you're joining us for future sessions later today, for day 1 of the conference, or day 2 tomorrow, or a post-conference session. If today is your last session with the conference, please complete the evaluation that I'll put in the chat box. If this is not your last session, we just ask that you wait to do your evaluation until your final session, whether that's today, tomorrow, or post-conference. So again, I'll put that in the chat. All right. Again, Bob, thank you so much. I think a lot of people have those resources to take home and figure out what to do next.
All right.
Thank you, Bob.
Bye-bye. Thanks, Amy.